Well, my name is Patty K. Wooldridge. I'm an RN with a Bachelor of Science degree in nursing, trained at Eastern Michigan University. I graduated in 1986. So I've been a practicing professional for 33 years, and that anniversary is just coming up in April. What I do is, for the last 21 years, I've been practicing what we call biooxidative medicine, and that covers two different therapies. Ozone therapy in medical situations and treating blood with ultraviolet light in medical situations. These therapies can deal with viruses, bacteria, mycoplasma, fungus, and molds in a very different way than antibiotics work. And they are often used with people who have gone through the regular routine traditional medical treatments and can't get anywhere else and don't get resolution with what they're going on. So what we try to do is assist the immune system and the body's own natural defenses to start working again in a way that they haven't been. So we treat blood with ultraviolet light or ozone or both together, and we were able to accomplish a up-regulating or down-regulating of the immune system. Okay, we do a lot of work with ozone in intra-articular joint injections, particularly for helping the body start rebuilding the cartilage in the joint, and we do that for pain relief for back pain, as an example. I'm a perfect example of that. I have my own herniated discs, and I get this treatment on a fairly regular basis to help me stay free of pain. So I don't have to use pain medications. The world is withdrawing opioids from most people now, and they don't have a recourse. So this is a wonderful recourse for people who are in pain. It does relieve the inflammation and resets the signals so that pain isn't being felt anymore, as an example. Now, ultraviolet blood irradiation therapy also creates ozone in blood, so when you treat blood with ultraviolet light, it acts differently than it does on the skin. And it starts driving all sorts of immune system reactions that are able to help the patient decrease pain levels, increase energy levels, get cellular structures working the way they should, reestablishing pH, reestablishing the electrical conductivities of the cells, the oxygen and the water within the cell.
My name is Cheryl Holder and I'm a teacher. I was invited to check out the ozone therapy because in 2014 I had surgery on my spine because of a fall. From that point until 3 weeks ago, I've lived in utter pain, and there was nothing that would help me. The last MRI I had said that I had scar tissue on the nerve, spinal stenosis, spurs on the vertebrae, and basically everything was messed up with my back. So when I was invited to try ozone, I was using a cane because normally I would have to bend because of the pain, and the cane would help take some of the weight and so forth. So my first set of injections, I think there were about 8 on both sides of the spinal area. And when they were through and I had to get down off the table, and I stood upright. For some, I don't know if it was a reflex, but I stood upright and I walked without the cane. And I've been walking without the cane since then.
My name is Richard Blades. I'm a business development specialist. Okay, I had the ultraviolet intravenous treatment, and what that does is that they purify the blood with ozone, and that goes into your body, and what it does is addresses all the issues that you may have going on within your body. The very first time I got it, my blood was less than desired, but then as the treatments went on, then what the feedback that I got was quite favorable, and then all the things that they told me I would experience during the course of the evening, I kind of experienced that a little bit stretched out. First, I felt the fever chills as all the bacteria in my body was being addressed, and that went away quickly by the next morning. I am going through a series of treatments in order to ensure that all the issues that I have that are health related get addressed.
I put an IV catheter cannula, attached a sterile line to it that had a little bit of heparin, and then that piece that was glass was placed in a little box, which is called a UV light box, and That line was attached to me on the other end that had 30 cc's of ozone in it, medical ozone at a specific concentration. And so because she only weighed 100 pounds, I could only treat 150 cc's of her blood, mixing it with the ozone and the oxygen each time it came to me in the syringe. Then after the end of that, I had to push it all back and then pull the IV line and compress that area so that she didn't have a big hematoma afterwards. So that's what does the magic.
I would really encourage people to try it because for me, the other medicines weren't working, and that is why I suffered the pain, because when other medications were prescribed and I did my research and I found out that they would harm other parts of organs and what have you. I'm coping a lot better now, having taken the oxygen injections. And like I said, this is the first time I felt real hope that things would get better, because from 2014 to 2019, and living every day in pain is not a nice thing.
If you're a person like me who doesn't like to be hooked on medication for lifelong experiences or for extended periods of time, I would recommend that you look at this treatment. Why? Because I believe that from the benefits I've experienced, and I'm not saying that everyone is the same, but I believe that you would also experience some benefits that are ideal to your body type, your situation, and your health needs, which would in turn ensure that you have a better quality of life as an individual.